Hello, I'm Lavette, Superintendent of Savannah Chatham County Public School System, and today we are very fortunate to have two members of our Medical Advisory Committee. This year, of course, facing a new variant with coronavirus, we have found it necessary to pull together some of the medical professionals that we've worked with over the past several years. This year, they've offered some especially important and critical information for us as we're proceeding with in-person instruction 5 days a week. So the landscape has changed. Today I wanted to have an opportunity to introduce them to you and to have them share some of the wisdom they've shared with us over the past several weeks. We are also fortunate today to have Sheila Blanco, our Public Relations and Public Information Officer, who will moderate this panel.
Thank you very much, Dr. Lavette. I want to introduce now everyone to the two gentlemen who are joining us today. We're very thankful for their time to come and answer some of these questions and have a discussion about all the kinds of health concerns and questions that a lot of our families have. We've got to my left, Dr. Stephen Thacker. He is the Associate Chief Medical Officer at Memorial Health. And to my right, we have Dr. Bonzo Reddick. He is with J.C. Lewis Primary Healthcare Center. Thank you both for joining us today.
Thank you.
We're going to launch right into some questions here. We all know that parents have had a lot of concerns throughout this school year and the past school year. They're a vital link in the chain of healthcare for their children, and a lot of times they ask, a big question, especially as we're heading into cold and flu season. What if my child has the symptoms of COVID-19? When should parents be more concerned about what you would normally think is just a small case of the sniffles and actually keep their child at home? What kind of advice do you have for them on how to judge?
Yeah. I'm happy to answer, but Dr. Reddick probably gets the first line engagement on that frequently. But my answer is that if you have new symptoms that are worrisome for infection, really that's the time to reach out to your primary care provider if you have them, to really run what's going through with your child with them to see if there's more that needs to be done. And certainly during periods of time when our communities are dealing with transmissible infections like COVID-19, it's a time to have a little bit more caution because our individual decisions and choices about sending our kids to school with symptoms of infection not only impact our own child and our own family, but also the children in that classroom as well as the teachers that are so critical to educating them.
And Dr. Reddick, as we've progressed in the school year and we've had a lot of students have to be quarantined because they're identified as close contacts. If somebody is on quarantine, a student's on quarantine, should their parents be taking them to their pediatrician, trying to make an appointment with their pediatrician to get a test, or should they report to one of the testing sites around the city?
And I think being proactive, I like that you asked that question because being proactive is probably very important for everyone to know what happens before the moment occurs. I've heard stories where parents, a kid has a close contact or they develop symptoms of COVID and they end up getting out of school, parents get off work and they run to the emergency room saying, I feel fine, I just need a COVID test. And that's not the correct place to go. So I think the first thing is to look around and see who has availability of which kind of test. There's two different kinds of COVID tests. There's a rapid test, and there's also what we call a PCR test, which actually takes a couple days to come back. And so just being aware of what services are available and what in their communities. The clinic I work at, J.C. Lewis Primary Healthcare Center, we actually provide testing each day. We're outside of our building, right on the side. We have a little tent set up, and we do testing outdoors, and you can just walk through and get tested pretty rapidly. So just identifying areas in your community that are close to where you are, where you can get tested. Most primary care offices, so both pediatricians and family physicians, have availability of testing, and so you can go to your regular primary care provider and typically receive a test. That's usually the best place to go, but there's also the issue of weekends that happen as well. So being aware of urgent care centers that are close to your house or other things like that where you can get tests is important. And go ahead and call ahead of time now and find out where in your community is the closest and easiest place for you to be tested so that when the moment comes, you're not trying to figure it out at the last minute.
That's a very good idea because at that point, a lot of times parents would probably be a little panicked about where they go, and it's not necessarily the time to have to spend the time making those calls. It's better if you have a plan in advance. A lot of the discussion at the beginning of the pandemic did center on people's perception that children were at lower risk of contracting COVID-19 than adults. So is this still true? Was it ever actually true? Or has it just changed with the Delta variant?
Happy to speak to it. It's been a really interesting story, right? You know, a year ago when this pandemic began, one of the blessings we thought and felt was that children were less impacted than adults were. And that certainly held true. And we even thought that children were much less likely to be infected. And there's probably a little bit of that, but as we've gone forward, just through random testing of blood samples from children that were not there for COVID-19, we found that many more children were infected than we thought with the first few surges that have come and gone. It's just that they were not symptomatic, and we didn't test them. So I don't think it's true that children are not impacted by this virus, and what the Delta variant has shown us has really proven that point because of this new variant and its ability to be more infectious and create many more copies of itself. So just the amount of virus inside of a person infected with the Delta variant is upwards of 1,000 times higher. We have more symptomatic children, more than we've ever had during this current resurgence due to the Delta variant. And so it's really clear that kids do get infected. It's likely as well that, you know, as you progress in age, you're more likely to share that infection with others. And I believe that we're finding evidence that this is more harmful to kids. Kids now, with this current resurgence, have about a 10 times higher risk of hospitalization than they did with the prior surges. And so parents should hear that and recognize that, gosh, this is a reason to really think hard about the decisions I make for my family, and honestly, how I support school systems on their strategies around safe education, because we need to vaccinate anyone who's going to be around that child that can be safely vaccinated, and we need to support right now masking in school systems because that helps slow the spread and keep your child healthy and keep your family and your community healthy as well, and in the classroom, which I think is everyone's goal.
Talking about the Delta variant, you just spoke about how much more contagious it is. I think that's what we've heard the most in the news. But you also just mentioned that children are actually being made sicker by it. So I think that's an important question. Is it causing more severe illnesses, or is it just that it's more contagious and more people are getting ill?
So a little bit of both has been my understanding. It's spread a lot easier than beforehand, and that's why you're seeing some people thought there's been some discrepancies about the vaccine effectiveness, for example, because they're saying, well, we're seeing these changes in breakthrough cases. First you said it was 95%, and then you said it was this different percent, and it's a lot more contagious. And like Dr. Thacker was saying, we are seeing a lot more children that are actually being hospitalized, which is a reflection of a more severe illness. And so we've been aware that there's the potential for severe illness, even with the first variants. The MIS situation, you may hear people talk about the sort of a multi-inflammatory problem, multi-system inflammatory condition that children have where multiple organs become inflamed. That's happened with COVID infections before, but we're seeing a lot more incidents of that type of situation and kids getting sick enough to be in the hospital. So more contagious and more potential for severe illness. So both are correct.
Wow. And, you know, you talk about the people who may have had it, like you mentioned that in taking blood from children who have come in for doctor's visits for something else, you've discovered that more had probably been exposed to it than was previously thought. So can asymptomatic adults and children both spread COVID-19?
They certainly can. You know, there was some discussion with the prior variants that have circulated that are folks that are asymptomatically infected, are they less likely to spread? You know, at this point, with how much virus is made in the nose and in the lungs of someone who's infected with this variant, whether they're symptomatic or not, there's a high risk of being able to spread that to others if you're not using distancing, you're not using masking as your strategies to prevent that spread. And so to me on both accords, the answer is yes, that asymptomatic children and adults can share this infection with others.
And talking about those people who are asymptomatic, you know, they may never know they have it, not even know they're spreading it. Those who do show symptoms, when are they most contagious? Is it not until those symptoms begin, or is it actually prior to the onset of symptoms? And how long after symptoms begin will somebody continue to be contagious, potentially contagious of COVID-19?
So unfortunately, you can spread it, and you're still can be very, very contagious even before you develop symptoms. And the other thing is that initial period between when the virus gets into your body and you are spreading to other people or becoming symptomatic is highly variable in different people. And that's why you'll see a lot of the guidelines about quarantining give you a 5-day range even before you can be considered to have a negative test for the first time. because there's so many differences. It could be 1 day, 2 days, 5 days before you would develop symptoms, and you could be spreading it to people in between during that time. So, and that's something that's really important to highlight, because I often hear a lot of people say, "Oh, well, I was around somebody when they had COVID, but that was before they got sick," and that's not necessarily that doesn't prove anything. That doesn't say anything really. So the sort of long story short is that you can spread it well before you become symptomatic, several days potentially before you become symptomatic, and obviously you can definitely spread it while you're still symptomatic. And so I'm really discouraging patients from just judging behavior or risk based on people having symptoms around them. And that's the other thing that we mentioned as well, vaccination. I know we'll probably get into that later on, but a lot of times people say, "Oh, I was around somebody, but they were vaccinated, so I'm okay." We do know that even though it's less likely, you can still pass the virus to other people even if you're vaccinated. The main benefit of vaccination we've seen is that people don't get really, really sick while they're vaccinated, and they don't typically have any problem, any risk of death while they're vaccinated. But like Dr. Thacker was saying, it's really a multi-system approach to this. There's not one specific answer. It's not, "Oh, if enough people get vaccinated, there's nothing to worry about." Or if you just wear your mask, there's nothing to worry about. Or if you just stay away from people who are sick, there's nothing to worry about. That's just not true.
Going back to what you said about, having been around somebody who wasn't sick until a few days after you were around them, that doesn't mean anything. If they all of a sudden if a friend calls you and says, "I just lost my sense of taste and smell" on Saturday morning, and you spent a significant amount of time around them Wednesday or Thursday, you probably want to isolate, get yourself tested, and make sure, because they could have been probably infected with COVID-19 for several days before they actually had that symptom come on. And if you were around them, you would be a close contact.
Yeah, and we kind of use rough guidelines that if you've been around them for more than 15 minutes or more, especially if you've been within 6 feet of them, that's probably a close enough contact that you probably need to quarantine yourself until you receive the appropriate number of negative tests over the appropriate number of days.
The self-isolation that someone should do if they have been around someone, if they're identified as a close contact of someone who either has been tested positive for COVID-19 or has the symptoms, does that differ? Does that process differ if you are vaccinated versus unvaccinated?
Yeah, it can be a confusing landscape out there when you're trying to say, how long should I be isolated or quarantined if I'm exposed or infected? And really, it matters kind of the environment you're in. If you're someone in healthcare, you might have a different set of guidelines than you would if you're someone who's not. So for the general population, the CDC guidance is pretty straightforward, that if you're someone who was infected with COVID-19 or you're confident you had symptoms of COVID-19, you should be isolated from others as much as you can be for 10 days from when your symptoms started. For those that get admitted to the hospital, sometimes that isolation period is longer, up to sometimes 3 weeks, and even longer if you have problems with your immune system. For those that are exposed, this is where it kind of gets a little confusing because your vaccination status changes what the guidance is. So if you're someone who's been fully vaccinated, so more than 2 weeks out from your second dose or your first of an mRNA vaccine or your first dose of Johnson & Johnson, that you don't necessarily have to quarantine or isolate as long as you're not having symptoms of it. You mask and when you're indoors with anyone else except your immediate family. And then it's recommended that you get tested anywhere from 3 to 5 days from your exposure. That becomes really complicated, honestly, and a challenge to follow, but that's the current guidance for vaccinated individuals. For those that are unvaccinated, if you've been exposed to COVID-19, which, just recap, it's within 6 feet and 15 minutes in a 24-hour period. Mm-hmm. So for most folks, if we're within 6 feet of someone who had COVID-19, we're usually around them if they're an acquaintance we know or a loved one for more than 15 minutes in the day. But with that, you should be quarantining for 14 days. There are some strategies to get out of quarantine earlier, but for most of the general population, that's the approach that you should take.
Talking about, you just outlined how the quarantine isolation measures are much less, at least less lengthy, mm-hmm. certainly for those who are vaccinated versus those who are not. I'd like both of you to touch on a little bit the importance of getting vaccinated based on what you are seeing in the medical community, what you are seeing with patients that are coming in. Dr. Reddick, would you like to go first?
Sure, absolutely. Yeah. So this is not just a Savannah, Georgia thing. I've seen this across the country, both in terms of just friends I know who are physicians all over the country, or things I've seen as far as on on news media or even social media from people's report, even from hospital statistics from counties and different states across the country, is that we're seeing that for people who are vaccinated, in most jurisdictions, you're talking about less than 1% chance of death, severe hospitalization, ending up in a ventilator. There was a report from Medical College of Georgia's hospital, at Augusta University, that there was one day where 100% of their patients who were in the ICU on ventilators or that had passed away from COVID were unvaccinated. And we're seeing those kind of numbers across the country. Again, if you look at the number of people that have died from COVID, we're talking about over 600,000 people. Out of that 600,000 people, somewhere around 1,400 were vaccinated. So you're talking about a tiny, tiny percent. You're talking about less than 99.2% of them are unvaccinated people. So you're talking about less than 1% of people that are actually vaccinated. So it's critical. Again, nobody wants to catch COVID, just like you don't want to catch the flu or you don't want to catch a common cold. Mm-hmm. But if you get the vaccine, you are just not likely to end up severely ill or die from it. It's very, very effective. We have some vaccines that are super effective, like the COVID vaccine, like polio, which we've eradicated from the country. And this is really a blessing as far as the COVID vaccine goes. And it's something that we should embrace. It's been studied extensively. Over a billion people have gotten it worldwide. And it's safe by any societal standard you use. It's way safer than driving a car or any of the things we do on a daily basis.
Dr. Thacker?
Yeah, I'd echo that, because when I think about, as a parent, what matters most to me is that I want to be there. I want to be healthy for my kids as they grow, and I want to be present. So for me, there's already now it's over 1.5 million examples of reasons why it's important to be vaccinated. Because right now, this is, to echo Dr. Reddick's point, this really should be thought of as a vaccine preventable disease. We have a very effective tool to prevent someone from getting harmed from this illness. And we know that this pandemic has taken the lives of like I said, over 1.5 million parents, grandparents, guardians, whose role was to be there and be present, to raise those kids that they loved. And really, moving forward, we really should not accept that it's okay that our community is having infection spread, that parents are getting sick and ending up in the hospital, and a measurable number are dying. And those are leaving kids without that loved one, that support person that was going to be there to help guide them and shepherd them into adulthood. And that's a loss that can't be recovered. And so to me, that is a tragedy of our health system and a tragedy of our communities, that we still have not shared the message about the importance of vaccination and gotten the message across to those that need to hear it, because we have far too many unvaccinated members of our community in Chatham County, Georgia, and the nation still. And it's very clear that when you look at communities that have a high uptake of vaccination and compare them to our community, which does not, that there are less people in the hospital, there is less death, and there are communities that are being kept whole. And so, if anything, hear the message that if you want to be present for your children, you want to be present for your community, that one of the most important things you can do right now during this pandemic is to choose vaccination for yourself if you've not already done so.
And Dr. Lavette, I wanted to give you a chance to say something, if you like, because I know that you have been very vocal in getting the message out to our families, to our staff, everyone that you've come in contact with since the day a vaccine became available, about the importance and how the more people that get vaccinated in our community, the better chance we have of keeping our schools open 5 days a week, just like we want to do, without the types of disruptions that we're seeing with quarantines and close contacts and stuff from these breakthrough cases.
I echo these gentlemen. They are saying the same things that we've said all along. One of the things that we want to do is ensure our future, and we can do that if we're present. We can't do that if we miss the opportunity to protect ourselves and those we love the most. I do think that one of the opportunities we have every time we have these kinds of conversations is to share that message with others who are on the fence. Each week we are learning about someone that we know, that we've maybe had a conversation with just a few days ago, and they're no longer here. Mm-hmm. And often we find that they did not take the opportunity to get a free vaccine. Mm-hmm. So we want really to have everyone know how strongly we feel about this, because anything we can do, masking, social distancing, keeping our hands clean. I think we've almost made it into a song that we say it at the beginning, at the end of all of our meetings and opportunities to get together. But our children are really important to us, and they take a lot of lessons from what they see us do. And if they see us looking at what the data says and taking every opportunity we have to protect them, then they will also go out and do the same with their friends, with their colleagues, and with their families. So it's really important. What's puzzling to me, because you see patients every day, we see and talk with parents and our colleagues every day. What is it that has made it so difficult for people to wrap their arms around the validity and the wisdom of taking the vaccine? I think that's the thing that's been most challenging for me. So if you could answer that question, I would really appreciate it. Because maybe someone who's listening and is on the fence will hear it from you as a person who sees patients and know that some of what we're seeing could be avoided.
And it's so different on so many levels. I think there's not one single answer. I think one big problem is that there's just a lot of misinformation out there. And it comes at people from a lot of different places. We're all attached to our phones these days. Social media's got something every other day. And a lot of people take things as gospel when they see it. They hear negative information about whatever's out there. If it wasn't COVID, it'd be something else, misinformation about everything these days. But as far as why people decide not to get vaccinated, some of it's that they've been scared by certain things. Some of it's by the past, that things have happened that are not appropriate in our medical system, as far as experimentation on people and things like that have happened in the lifetimes of some people who are still alive right now. And so there's some reasons for that, but sometimes there's other reasons as well. Sometimes it's access. I've had patients who haven't had social security numbers, who sometimes didn't think they could get vaccinated or thought they would get in trouble if they came to get vaccinated. I've had people who would actually not mind getting the vaccine, but they don't go to the doctor. They're maybe working from home or isolated, and they say, well, I don't think I need to. I don't really go anywhere. I wear a mask when I go to the store. It's not a big deal. Or even it's just not convenient. They work 9 to 5, and they say, well, I don't really have time to get off to get a vaccine, so it's not a big deal. We have a mobile clinic that we do every week. And there's been lots of times where somebody just happens to be walking by and they're like, oh, you got the vaccine? I've been wanting to get it, but I didn't know where I could go. It's right here. I can get it right now? Sure. So there's a lot of reasons. A lot of times when you talk to people and just explore their reason, then you can get to the heart of the matter. There's some people who have conspiracy theories and ideas about it, and it's going to be difficult to talk them into it. But sometimes it's just simple information like going over the basic stats. Like one time somebody was saying, I heard a lot of people are dying from the vaccine. And I said, well, right now, about 50% of America has been vaccinated, about 50% hasn't. So just look at the two groups. They're the same size. Which group dies way more than the other one? You can look it up and find the answer. I've done that, and that's been effective sometimes. I've seen people sometimes who had spiritual or religious beliefs and thought they could not get the vaccine because of those beliefs. I've explored it with them, and several people I've talked to have actually gotten the vaccine as a result after just listening to them and exploring it. So a lot of reasons out there. Probably the biggest enemy we have right now is misinformation and people who either willingly or unwillingly are trying to spread information that's detrimental to other people. But there's also a lot of other reasons that people have. So I think we should be careful not to kind of finger wag at people who haven't been vaccinated yet, but just have conversation with them, explore their reasons. And I'm starting to lose track now of how many people that were convinced they would never get the vaccine, but just either through time, multiple conversations, answering questions. I get text messages and phone calls every day like, yeah, man, I went ahead and finally got it. So I'm hoping there'll be more and more of those.
Great.
Yeah, I do as well agree that it's pretty multifactorial. I think there's a small percentage of those folks that are so wedded to ideas that are really not based on any fact or sound science that some of those folks are going to be difficult to reach. What I've found is that there's far more individuals that just needed that moment, that opportunity to have a non-judgmental interaction with a healthcare provider. And I do this as well, give my phone number to anyone who wants to call, whether it be someone's family member in Colorado or California, that sometimes it's just being able to ask your question to your healthcare provider and have the time to do that as well. And then there's access issues. When you think about just access to the health systems, because we've set up mass vaccination sites, and there's many individuals in our community, but that is not the solution to get them vaccinated because they don't have transportation to get there. It's not at the time of days it makes sense for them to continue to be at work and support their families. So there is no bad idea in my mind when it comes to how do we increase access to vaccination, because no matter what idea you use, as long as you're making a resource available, someone's going to recognize this is the opportunity for me. So I think what we need to do is really continue to push and challenge ourselves to come up with new strategies to give access to vaccines throughout our communities. And we already had the big wins of all the big mass vaccination sites of getting large numbers of the community. Right now, we need a whole lot of smaller wins. We need to reach communities that are smaller in size and come to them most often with the vaccines. And so that's where I'm happy that we have partners in the community that are tackling that, and some of our health systems, Memorial and St. Joe Candler, just creating different avenues and strategies that might be the answer for someone who's been waiting on that moment to be able to get vaccinated.
Can I make one more quick comment? I think everybody assumes that folks know that the vaccine is free, but people still don't know that. And so that's also one barrier that since we're here today, I want to make sure we clarify again that the vaccine in every state in America, every city in America is free. You don't have to pay anything. You do not have to have insurance. You do not have to have a social security number. You can get the vaccine for free. The reason why I bring this up is that there's been almost no time during this entire vaccination process where I haven't had a patient ask me how much is it going to cost. And as most recently as 2 weeks ago when we were doing our mobile clinic, where a patient came up and said, "Oh my gosh, I forgot my Medicaid card." And I said, "You don't need it." "Well, how much is it going to cost?" "Nothing. Doesn't matter." And he's like, "Really?" And so people still, at least as of 2 weeks ago, people were still coming up on a regular basis to me asking how much it is. It doesn't cost anything. You can get it for free. Usually available every day of the week. Definitely easily available Monday through Saturdays, and often in different locations in the communities on Sundays.
I know when I got mine, when we held some vaccination clinics for the school district, it's one of the few, probably the only medical thing I've ever had done that didn't have to pull out my ID. Well, I think I pulled out my ID, but insurance card. You didn't have to do any of that, and it was in and out in 15 minutes. It was so simple and fast and completely free. There's been a lot of discussion about people getting vaccines if they need to get them if they've already had COVID, because the thought is, well, these vaccines are creating antibodies, and if I've already had COVID and recovered from it, then that should have created the antibodies. Is that true or not? Do people who have had COVID and recovered need to get the vaccine?
Yeah. So the answer there is really a clear yes. It was a yes before we even knew why it was yes earlier in the pandemic. And so now we have the experience of seeing those individuals who were infected with the first surges in this pandemic, a year ago or a year plus now. And what we know is that when you look at individuals who had infection previously and compare them to individuals who had infection and got at least a single dose of our current COVID-19 vaccines, that those that didn't get that additional dose of vaccination had twice the risk of breakthrough infection. Because it is true that being infected with something creates antibodies, but the way that our immune system works, it's like trying to study for a test that's going to take in the future. When your body's responding to the organism, in this case a virus, it's making antibodies against a bunch of different proteins, hundreds and hundreds and hundreds. And so sometimes the effectiveness of your body remembering the right antibody that protects you is a little bit lower. And so what we do with the vaccine is like studying for 100 question test versus a 1 question test. And so the benefits is the effective science and that has shown that this targeted vaccine that's really making one antibody is a very effective strategy for your body to remember and protect you if you get exposed to this virus in the future. And so that's the added benefit that the vaccination provides to those that were infected, is it really just focuses your immune system on the most effective strategy to keep you protected.
There has been talk of booster shots. I think everybody is at this point assuming that at some point that may be necessary, or a potentially slightly altered shot to handle different variants, like they do with the flu every year. They create a different flu vaccine every year that's built to target the flu strain that scientists expect to sweep through the community that year. Which way do you see this going? More as a booster shot or a slightly altered COVID shot, COVID vaccine that is built to deal with these different variants as they come along?
And that's something we're working on the best available evidence right now. So we're not 100% sure what it's going to look like. I know Dr. Fauci recently on the news said that he was confident that a third shot, the booster shot after you've gotten the 2-series vaccine, might be enough to give you that long-term immunity, and that may be it. Other experts have said this was going to be like the flu, where you just get a booster once a year. We're not 100% sure. What time will tell. Again, the fortunate thing is that when you are vaccinated fully, and then when you get, it looks like probably with boosters as well, that, again, your risk of dying from COVID or ending up in the hospital or ending up on a breathing machine or a ventilator is almost zero. It's as close to zero as you can get, just about. So right now, the current recommendations, people are kind of arguing back and forth a little bit. But in general, the recommendation right now is that for that first wave of people who were vaccinated, I was in that group, I think Dr. Thacker probably was, who were vaccinated kind of last December up to January of this year, probably need to be get their booster by about September 20th is the deadline I've heard from various experts. And then the other guidance for other folks is somewhere between 6 and 8 months after you finish your vaccine series, probably time for a booster. That may change. Again, we're going to follow the data about what happens to people as they get their boosters and what the rates of breakthrough infections are. I think the biggest thing that we've seen as far as those antibodies that are starting to drift down is that, especially in people that are elderly, kind of over 65, people living in nursing home facilities, those are the people that we're really seeing that are really vulnerable. So those patients, as well as people in that first wave of vaccinations, is probably time for a booster. And I guess time will tell as far as what will this look like going forward.
We know they haven't approved the vaccine for anyone younger than the age of 12 yet, but we are seeing school districts, several of the largest school districts in the country have said they're going to mandate vaccines for students and staff. Several universities, more than several universities, a number of universities across the country have mandated vaccines. This is something Dr. Lavette may want to weigh in on as well, because we get questions from parents. Well, are you going to mandate vaccines? Why aren't you mandating vaccines? There may be different factors that play into that based on the community, based on the state, based on politics, where you live. Don't know, but what are each of your thoughts on it? And Dr. Lavette, I definitely would like you to weigh on it, because it is a question we get.
Yeah, I can start off. So for me, just a reminder that we already mandate vaccinations for schools, and these are for diseases that we don't see. Young doctors that are training, they don't see chickenpox anymore because we have an effective vaccine that helps prevent it. And so to me, this is an opportunity, I think, that we will have in the future, where I do think this may be part of the recommended vaccine series. That decision's certainly not been made yet. But to answer the question about younger children as well, we have really good, solid evidence from both the Pfizer company and the Moderna that make these mRNA vaccines about the safety and efficacy in kids 5 to 11. The FDA wanted them to basically double their clinical trials, which is what they're currently wrapping up right now. And I fully expect that by the beginning of next year, 2022, that we'll see that age range has now been included in the safe indication for this vaccine. That'll first be under the same emergency use authorization, or EUA process, but eventually will follow with full FDA approval. So I think it's coming. The preliminary trial data shows that it's just as safe, and if not, actually more effective, because of the way our immune system changes over time when we were young compared to when we were old.
And I would like to weigh in on that as well. I've had conversation with Dr. Lavette and our mayor as well, and I do understand. I'm coming from a standpoint of purely just the medicine and the science. I know there's layers of bureaucracy and legal issues and things that are way above my pay grade. So I'm saying it's just in the context of science. I'm not saying it's going to be easy to do what we're talking about. But I am in favor of, if it's something that is feasible and that can be worked out, in favor of vaccine mandates. Like Dr. Thacker said, we do it all the time. For me, I've never had many medical problems as a kid, fortunately. Never got a flu shot a day of my life, but when I got to medical school, I got my first flu shot, and I had to get it every year, and I've gotten it every year since then. And if I don't do it, I will not be working at J.C. Lewis Primary Healthcare Center. I will probably lose my privileges at Memorial Hospital. So that's something we require all the time. It's for the good. It's for the good of the public. And there's a lot of things that we're required to do that actually don't save other people's lives. We're required to wear seatbelts by law. If I don't have my seatbelt on and I get in a car accident, that doesn't hurt anybody else except for myself. But by spreading coronavirus to somebody else, I do hurt other people. So I'm in favor of a mandate. I think that's even a public health kind of opportunity to increase the vaccination rates, because there's a lot of people I run into who don't feel like getting the vaccine, but if you kind of say you really have to get it, they'll say, okay, that's fine. There was one thing that just blew my mind. There was that hospital in Houston, Texas, where the people were kind of protesting, saying
the
they didn't want to
nursing
get
staff,
they want to get the staff didn't want to get vaccinated, and they said they were going to quit if they were required to get vaccinated. There was a lawsuit. They lost the case, and the hospital system won, and they said you can require the vaccine to happen. And I saw that 96% of the people got vaccinated. I mean, that's astounding. And I think they said 2% received like a religious or medical exemption, and then only 2% of them actually quit. So there's this idea, this fear that, well, if we do a vaccine mandate, everybody's just going to walk out. But that's not true. Most people will go ahead and get it. You know, our CEO was kind of going back and forth initially and said, finally, you know, the surge is getting worse. The Delta variant is getting worse. This vaccine is working. We're going to make it a requirement for everybody here. And, you know, we only had one person who left.
Well, and I think that when it comes to schools, every parent, I certainly remember it, taking my child from when she was itty bitty to she was a toddler, getting ready for school and making sure she had all those vaccinations, all those immunizations before she started school. And it's painful as a parent. You remember every one, because some of them are a series of 3 or a series of 4, and you've got a little child there. But it is required. There are so many shots that we require for people to attend school, all the way up through, I think there's even some that they get by 9th grade. You know, ever since they were a toddler, they've been getting immunizations. So what are your thoughts, Dr. Lavette, on this? I know that a lot of things may not be in the district's control. It could be Georgia Department of Education, you know, something like that they need to mandate. I'm not sure where that comes from, that directive.
I think, you know, both of the physicians have said our students are already required to take certain vaccinations, and they're also required to have their eyes and ears and vision checked every year. We should be doing the things that we know protect children, and sometimes we have to mandate things. I think this is one of them, and I hope that the science will prove that we really love our children enough to sometimes put into place things that people are very uncomfortable with. I think what makes this more challenging is the political context around this conversation. But I think if you talk with most people, they want what's best for children. They may have differences with their peers, but they really want what's best for their children, and they want to protect their children. I think mandating this vaccine or any other that will prolong the life of children is what we must do. So I believe that we may get to that point. I hope we do. We don't have tuberculosis the way we used to. We certainly don't have chickenpox. I remember having the mumps. That was horrible. And I think there are lots of other things that we do. We test for scoliosis. We do lots of things that help children grow and develop in positive ways. And hopefully, we'll get to the point that we will see parents embrace when those vaccines become available, that we will see parents embrace and walk up and get the vaccine for their children. We also recognize that there are clearly people, a percentage, who don't believe in vaccines, and we understand that. And I think that's also why you have other ways for children to be served educationally. But I believe that it is really important for us to follow the science and use every method we have to protect our children. And I'll also echo what the doctors have said as well. It's not just the children, it's also the adults around them. The adults in their home, the adults in their school, in their churches. We all want to protect our children. And I think we all must do whatever is required to do that. If we were in a place and someone came in, God forbid, to create harm for our children, the first thing that we do is instinctive, that we grab our children, protect our children. We may be harmed, but our children are safe. I see it the same way with the vaccine. Why would I not protect my children? Why would I not protect myself so my children will be able to see their future?
We started this school year, and really basically it started in the summer. You know, the vaccines came out, large we're at about 50% vaccination rate, 51% nationwide. Everybody's ready to get back to normal. So this fall, we have not just returned to school 5 days a week in person. We've also got athletic events going on. Everybody gets to cheer on their favorite team. We got football, basketball, and a variety of other sports being played right now. Well, maybe not. Well, yes, actually, it's football day, isn't it? We're
Friday.
recording this on a Friday. So, we also, in addition to the students playing, the student athletes playing, we have arenas, we have stadiums with a lot more people in them. Even if we're not at full capacity indoors, we've got a lot more people than we had last year. So, the question is that safe? And is the question of safety impacted by whether it's an indoor or an outdoor event, or can an indoor event be just as safe as long as there's distancing and masks worn?
Yeah, I mean, I can speak to that. It's very similar. So there's benefit that our students get from physical activity and participating in sports. We certainly have learned a lot during this pandemic, as some school systems took a variety of different approaches of how they did in-person education and how they did sports and sports education. And so what we've learned from that is that when you look at areas where there's challenges with COVID-19 related to sports teams, it's really reflective of a high prevalence of the disease in their community. We've also learned that outdoor sports have a much lower rate of spread. And we've learned that when we do contact tracing for those student athletes, that when there are positive cases in that team, that oftentimes that exposure and that reason for that infection came from events unrelated to the direct sporting event itself. So it's, what do we do when we're not on the field? What do we do when we're not on the court? And that's where we need those very intentionally designed strategies to prevent the spread of this infection. And what I mean by that is, when we're gathered indoors, we need to be masked. We need to encourage vaccination for our student athletes that are of age, that it can be provided to them. And we need to make sure that we're paying attention. And we need to, as parents of student athletes, to really, again, model those good behaviors so that they will follow our lead when they're in that locker room or when they're on the bus. And we need to be intentional, again, about how we move from venue to venue, that we need to think about masking, having good hand hygiene, and having a really low threshold to say, I'm going to get this student athlete tested. I'm going to keep them away from the rest of the team until I know if they have an illness that they could spread to others. Because we're learning, and I think we will continue to learn in the years moving forward, what is the consequence of infection. And for some folks that are in highly competitive athletic areas, it's changed their ability to perform. And also, not only in the athletic space, when we think about post-COVID syndrome or long COVID, whatever you want to call it, we're recognizing that this happens in adults. About 25% of adults will have lasting symptoms following their infection. We're also learning this is happening in kids. And one of my big worries about us not keeping kids protected and having them get infected is that this brain fog, this issues with cognitive processing, is going to limit the academic success of some children because we did not do our best as communities to keep them protected. And so that's my big worry moving forward. Also worry for my own children, the ones that cannot receive the vaccine, because I have a 13-year-old who was day one, got a shot and got both, because that's my best strategy to keep him healthy and well, and make sure he has both academic success as well as any athletic he may in the future choose. We're still working on that, but athletic success nonetheless. All right, I'll turn it over to Dr. Reddick.
Dr. Reddick, what about the spectators? Is it safer to be at an outdoor event versus an indoor, or can indoor be just as safe as long as they're distanced and wear a mask?
Yeah, so like Dr. Thacker said, outdoors definitely seems to be safer in general. There's simple things like changes in weather can affect how easily the virus is transmitted or not, humidity levels and temperature and things like that. So in general, outdoors, again, is better. The 6 feet of social distancing is very important across the board. So especially indoors, that social distancing and masking and trying to have as many people there vaccinated as possible. I know we've kind of said that a little bit like repetitively now, but it's not just one single thing, it's all of that together. And I agree with him about just how I feel about my kids in being in school right now. I have 3 kids. 2 are old enough to be vaccinated. They were both vaccinated the first week it was available for them. But I do have 1 child, and they're all 3 in the public school system here in Savannah. But I have 1 who's too young to be vaccinated, and she's masked. They try their best to keep them separated while they're in school. They only are allowed to take their mask off when they're outdoors, and so I think following those guidelines and being consistent is important. And there's been a lot of models of people being able to do that with sports and still continue to do it. A lot of people say that, oh, you're living in fear and you're always worried about this and that. You got to just live life. I'm not necessarily living in fear, but I am also trying to just be cautious. I'm not living in fear when I put my seatbelt on, but it's a smart thing to do, and I'm being cautious. But there are some places you've seen that even the National Football League, this NFL season started last night, and they had really a lot of problems with outbreaks and spread of COVID, kind of early stages. But now they've gotten their vaccination rates up very, very high, and they're being very serious about quarantining people who are close contacts and unvaccinated, or people who have symptoms or who are confirmed to have COVID. Mm-hmm. And their incidence rate is going down to like 1% in a relatively quick period of time, because they have like 95% of the league vaccinated now. And when someone's positive, they will pull them out. There was a Pro Bowler last night for the Dallas Cowboys that wasn't able to play because he was quarantining, and they're going to make sure he's out for a certain number of days. So, like you said, I know somebody, some parents or kids may not like it. Our student athletes may not like it. 2 of my kids, the 2 oldest ones, are both involved in Chatham County Public School sports right now. But if something happens and they develop symptoms, or they're around somebody who tests positive, then they're going to have to get yanked out for a while until they're cleared to return. And we have to be patient and be consistent.
Now, I do want to make a point that when we talk to the student athletes, their thoughts, because we surveyed them last spring about vaccinations, and they were at that point not real cool about it. They were like, oh, I don't think we want to be vaccinated. This fall is very different, because they've had this experience of, we're not able to play this week because of COVID-related issues. So with that, they've changed a bit. They now want to be vaccinated. So we are hosting clinics where particularly the students can come with their family members and be vaccinated. The other thing that I think is that they suggested last spring, which we're looking into, is the regular testing. Their solution to me last spring was, well, just test us every week. We don't mind being tested every week. So they are now looking at what's happening. The NBA in the bubble, you still had COVID infections. They looked at the NFL requirements for this year, and then they talked about it. And I think that tells us that regardless of what our opinions are as adults, they are very, very astute, and they are looking at what's happening in these commercial enterprises that allow the players to continue to play. I think it's important for them to continue to have extracurricular activities. So if we reduce the capacity of an event, so we can only have a certain number of spectators. Last year we had a very successful winter sports season, spring sports season, despite the fact that we had COVID cases. They were very, very minimal. One of the things we're looking at right now is, because the Delta variant is a different strain and having a different impact, how can we ensure that we are protecting our young people? They like it much better if I'm a close contact, if I can be out a limited number of days, but if I'm vaccinated, I can be out even fewer. So they are looking at it from that perspective. Their math is really good. They have figured it out, and we want to be able to ensure that they have those playing opportunities if they want.
And they can see those types of things happening in college sports as well. I know a number of conferences, last year everybody had a limited schedule and the vaccine wasn't available till after the first of the year. So if a team couldn't play because they had an outbreak of COVID, the conference would work with them to reschedule a game. Well, now they're saying you have to have, I think, 100% of your team vaccinated in some conferences. And if you don't, and if there's a COVID outbreak, sorry, you forfeit if you aren't able to play. So they're really stressing how important it is for the athletes to be careful, and for everyone around their athletic programs to be careful. I just have one more question for you all. You talked about some questions that people have about getting the vaccine. You talked about also the ability of some people to get the vaccine. Either they can't get time off from work, can't get transportation to a vaccine event, or aren't sure that they weren't aware that it was free. those are all part of, kind of health equity for everyone across our community. And I wanted to ask you all to weigh in on what steps you think we could take to help promote equity, health equity in Savannah-Chatham County Public Schools.
I'm losing track of whose turn it was.
Oh, sure. Yeah, I mean, I can lead off, and I may be dipping my toes in something that needs to be edited out. I don't know. But, I very much fall in line with the U.S. Preventive Task Force on this for communities that the idea of school-based health clinics makes so much sense to drive things around health education and community. I would love for our school systems to, is there a way for us to operationalize that? That I know is a long-term plan, but it has a lot of direct benefits of being able to provide health education, health interventions, and primary care services in the place that we know children will be, which is school, and during a time at which they're present. So that has a lot of benefits. We know that can be a driver. Health equity is so much more complicated than just that one solution, though. And for me, what can we control right now that can drive and improve health equity for our communities? To me, it's having kids in school in person. Because for so many members of our community, the place where our children can receive education that helps them understand their health and how to make good choices for their health moving forward is in school. The place where they can get counseling about how they're feeling, about what they can do with their confused emotions, particularly, is in school. The place where they can get social development and support network that maintains good mental health and wellness is at school. And then for some of our children in our community that have additional needs because of their underlying health conditions, school is where they get therapy. So to me, one of the biggest things schools can do to maintain good health equity is make sure they have effective policies and procedures and plans to make school environment as safe as it can be. And I'm very thankful that my children are part of the Savannah-Chatham Public School System because I believe we're there.
Dr. Reddick?
Yeah, and this is one of my favorite topics to talk about.
Yeah.
So hear health equity, and I get kind of excited. So, but I've actually been a participant in the Department of Public Health's Health Equity Council for the state of Georgia, and we meet about every other week or so. And this is what we've been talking about since the beginning of this whole process. And health equity, a lot of different areas we're talking about in terms of communities, in terms of socioeconomic status, poverty or not, race and ethnicity, geographic location, rural versus suburban versus urban. And so across the board, I think just general principles that are out there are one is just, again, communication and education. And that needs to be in what we call CLASS, the cultural and linguistically appropriate services. So for people who have English as a second language, making sure that materials are available in multiple languages. So I think about 10% or so of the state of Georgia are primarily Spanish-speaking people. And so that was one thing we noticed early in the process was that a lot of the websites or vaccine forms were only in English, and so people can understand them. Reaching out to people who are maybe don't have a social security number or who are not citizens, whether or not they're visas or visiting or whatever, making sure that people understand that this vaccine is available to everybody. So I think that's important. And again, making it available just in the community, trying to get out and get around and make it available to folks. I love the idea of school-based care as well. And even just mobile services as well, being able to go out to people's homes and give vaccines that way, which some people in the community are doing as well. So that's the big thing, making sure it's in language that people can understand, that is the people that are providing that information are patient and not, again, finger wagging and saying what's wrong with you, or you're a conspiracy theorist, but making sure we listen to them and find out what questions they have and answering their questions with the science that's out there. And again, I think, again, the health equity piece is also the layer for the people who are not able to be vaccinated. I'm not inquired because we're not at the point of mandates yet, but I would feel great if I were to find out my youngest kid, who's the one who's not able to be vaccinated, if her teacher has the vaccine. that would make me feel great. So for the people who are vulnerable, who aren't old enough to get the vaccine, or let's say there's a teacher in the school system who has a healthcare condition where they're immune compromised, maybe they're undergoing cancer, chemotherapy, or on medicines that suppress their immune system. Like knowing that the people around them are vaccinated is a way to promote health equity in those patients, those people as well. So I think making it available to people, having the information out there in a culturally and linguistically appropriate manner, and maintaining that cultural competence, making the vaccine available to everyone, making it easy to get to, and also for people that are around folks who are high risk or not able to be vaccinated, making sure as many of them are vaccinated as possible.
And I think those are excellent suggestions. Certainly, just even having you as a part of a medical advisory committee is really helpful to us because I've called on individuals all last year and people were ready to respond. We passed along information. We're one of the few school districts in the state, too, that has a nurse in every building. And while we are struggling with that because they are very often drawn away by hospitals and doctors' offices, we have maintained a really solid core of school nurses, where in other districts in the state, they're not that fortunate. So we have that healthcare professional in each of our schools and certainly work really hard to make sure the services are there. And we rely on many of our healthcare organizations in the city to provide mobile services and make sure our parents know that they can access, behavioral health counseling or perhaps physicals or dental services. We want to make sure that that continues and to expand on that as much as we can. I really would love to see us duplicate the community health screening clinic that we have at Beach High School. I'd love to see that happen all across or several places in the city. We've been able to provide food pantries at 26 of our locations and behavioral health counseling at 16 locations. But it's just not enough yet. So we're going to continue to depend on you to help us get the word out, but more importantly, for us to grow in different ways so that we can increase access. For so many of our families, they simply are just overwhelmed and cannot get to health services. So I like it when we can roll the service up to the door. They give me permission and I can make sure that their children's needs are attended to. Those are our future presidents and doctors and clerks and drivers. They're the future of our country. So I feel especially compelled to draw upon you and the resources in our community to ensure their future. After all, I want them to be able to attend to me when I can't attend to myself. And I want them to feel confident that they've had the best experience ever to get them prepared. So I can't thank you enough for all that you do to help us, but to help our community. And I feel confident that together we'll be able to get the word out, help people understand the importance of being vaccinated, more importantly, appealing to their sense of obligation to their children to make sure the children are protected. Because if they are protected, the children are protected, they'll make sure that the children are protected. And I think we'll be able to conquer this as a community.
Well, thank you, Dr. Lavette, for asking these gentlemen to join us today and share some of the knowledge that they've been sharing with you and other administrative staff in the district for the last year and a half as we've worked our way through this. And thank you, Dr. Thacker and Dr. Reddick, for giving of your time today. I hope that everyone who watches this learns a little something new and gets a better perspective on exactly how decisions are made and what is the best way to move forward and get out of this and get back to normal, what we all want, right? Thank you all very much.
Thanks for having us.
Thank you.